now we have Representative David Morales. He's going to say a few words.
Hello everyone, as it was stated before, since the outbreak of the COVID-19 pandemic last year in March, literally over 12 months ago today, it has been our communities of color who have been on the front lines, working at the grocery stores, on the front lines, working in healthcare settings as janitorial staff to provide the necessary services that all of our communities have needed to not only keep our economy afloat, but to ensure that we have the basic services we've needed throughout this pandemic. Yet, when COVID testing was first launched, there was a disproportionate number of communities of color, individuals of color, who were not able to receive the COVID test. Same thing happened when the vaccine was rolled out. Our communities were not prioritized until we actually stood up and said, we have been the ones sacrificing our health, earning low wages, yet we are not receiving the benefits of the actual vaccine itself. And while there's been some progress made on the city levels within Pawtucket, Central Falls, and Providence, going through the launch of vaccines based on zip code, as it has been stated before, that is not sufficient. We need to ensure that all individuals, all people of color, especially those on the front lines, have the opportunity to get the COVID vaccine as soon as they can. But most importantly, we have to be conscious, and I'm going to challenge our city and state leaders to really think about how we're going to communicate this information. Our communities are not always on social media. We are not always checking Facebook and waiting for what the mayor has to say. We do not have that privilege to do that. Therefore, I'm asking that when we launch more and more test sites, that we actually do it within the neighborhoods. That Mount Pleasant, that Valley, that the South Side actually gets a testing and vaccine clinic within their actual neighborhoods, where they're not forced to have to go to the other part of the city in order to get the vaccine. You need to meet individuals where they are at. And alongside that, have an informative campaign telling individuals and informing people that it is safe to do, that not only that, but on top of that, where and how they can get the vaccine. Because there are a lot of questions that have been unanswered. And the burden ends up falling on us. It ends up falling on the working people, having to communicate with our families and our friends. But that is not how we're going to ensure that there is a mass vaccination for the people who desperately need it. So again, that looks like adjusting the city budget. That looks like adjusting the state budget, making sure that there's more allocation for COVID-19 vaccine administration, but most importantly, actually informing individuals on how they can get the vaccine. Because it's not enough to put up a flyer and say, hey, we're vaccinating these different zip codes, look at the progress we're making. It's about actually speaking to the individuals on the ground, speaking to the working people, again, the frontline workers who are sacrificing their health and ensuring that they know how to get the vaccine and that they get it done efficiently. Thank you.